Hi, my name is Mitch Ziegler. I'm a physical therapist at Spring Arbor University of Physical Therapy. And today we're going to present a video to you that talks about how to decrease inflammation in your body and to try to help these areas that are in pain, to try to decrease that pain area a little bit too. So we're going to go over 5 different things that I go over with my patients. And so number one, we're going to go over something called tweaking. So tweaking is what happens when you move the area of your body and it kind of creates a sharp pain or an aggravation in that area. So we don't want to have these. The tweaks actually create inflammation and they will perpetuate the pain that you're having. So what I use normally is I kind of use my hands and show that this is maybe how many tweaks you have throughout the day, and our goal is to get it down. So each day we want to try to lower the amount of tweaks that you have in that area. And by doing that, that'll decrease the irritation in the area and that will allow the tissues to heal. So first, number one thing, we have to decrease the tweaks. And second thing is you can't touch the area that you hurt. So for instance, I'll just demonstrate in the neck. When people have neck pain, they'll typically just constantly touch that area, or really any area that's hurting. People have a tendency to go and touch that area and rub it and play with it. So rule number 2, you cannot touch the area that you hurt. Rule number 3 is you can't stretch the area that you've hurt all day long. So it's common, and healthcare workers are notorious for this, of injuring themselves and not taking care of themselves very well. But, so for instance, if someone has a neck injury, what they'll do is then they'll go in and they'll start stretching that area out, and they'll do it hundreds of times throughout the day, and they'll wonder why their neck's getting worse throughout the day. And the reason is you just can't manipulate that area and stretch those tissues over and over again throughout the day because the body's just not used to that. That's just like, for instance, if you wanted to stretch your hamstrings and you haven't done that in a while, and then you go out and stretch your hamstrings 20 times in a day, those hamstrings are going to be extremely sore. So rule number 3, you can't stretch the area or do any crazy weird movements to the area that you wouldn't normally do. Number 4 thing is ice. I want you to use ice. So let's refer back to rule number 1, or suggestion number 1 is tweak. So every time you tweak something, you've created an inflammation response. And when you have that inflammation response, it's a good idea to put ice on it to try to calm that inflammation response down. So I want you to use ice. As long as you have any tweaks throughout the day, you go to ice. And so ice is, a good reference is about 3 to 5 times a day. And lastly, when you've tweaked that area a lot throughout the day, and it's really stirred up, it's a good idea not only to use ice and do all the things we just talked about, but maybe add ibuprofen to it too. And ibuprofen is only good for short durations of time, like 1 to 3 days. If it hasn't made a dent in the pain or decreased it, then it's really not going to be helpful, and we need to discuss why the pain is still at high levels with all these things that we're doing. So 5 things. First one, get your tweaks down. Second, don't touch the area. Number 3, don't constantly move or stretch the area. Number 4, use ice 3 to 5 times a day. And for about 20 minutes, the ice should be on, no longer than that. And number 5, use ibuprofen if you have a really bad flare-up. And so those are the 5 things that are the anti-inflammatory rules that we teach here at Spring Arbor University. So try these. I think you'll find them extremely helpful. If you have any questions, the number for the clinic is in the description for this video, and please check out some of our other videos that we've posted that are good patient care videos. Thank you very much. Have a blessed day.